بسم الله الرحمن الرحيم، والصلاة والسلام على أشرف خلق الله سيدنا ونبينا محمد عليه وعلى آله وصحبه وسلم التسليم. نرحب فيكم في محاضرة عامة. أستاذ فهد عنقد طلب من يديكم مقدمة بسيطة بالعربي عن المشروع اللي نشتغل معاه مع بروف جيمس وبروف ديفتي ضمن جائزة الأمير فيصل بن فهد للأبحاث الرياضية. كان عدد المتقدمين للجائزة 400 متقدم all over the world. الجائزة هذه طبعا بتعنى بالأبحاث الرياضية في مدن المملكة، وكيف بنعزز الفيزيكال اكتيفيتي، جودة الحياة، كل الأمور هذه. فولله الحمد من 400 مرشح تم ترشيح 20 مرشح حول العالم، وكانوا يعني بفضل الله ثم جهود الزملاء معنا كان المقترح طبعا من المقترحات الفائزة بهذا المشروع. المشروع تبعنا بشكل عام اللي اشتغلنا عليه في مدينة جدة، بنشوف الفيزيكال اكتيفيتي للمراهقين من سن 12 ل 15 سنة، سواء في مدارسهم وفي بيوتهم. عملنا بايلوت تقريبا لأكثر من 20 مدرسة أولاد وبنات حكومي وخاص. شفنا العادات المختلفة، البيهيفير المختلفة ما بين الطلاب المدارس الحكومية، المدارس الخاصة، الأحياء، النطاق الجغرافي لها، إيش في قريب منهم، دراسة متكاملة. الآن إحنا في مرحلة الكتابة. الفايندينجز بالنسبة لي أنا خصيصا كانت صادمة حقيقة، إنه الأطفال عندنا ما يمشوا على الآيبادز، على الآيفونز، على اليوتيوب. يعني نسبة الفيزيكال اكتيفيتي كانت جدا ضئيلة، وهذا كان صدمة. كان متوقع من الباحثين طبعا اللي عندهم ممارسات اقدر اقول جدا كبيره، وانا افتخر صراحه اني اشتغلت معاهم في هذا البحث، ويكون امتداد بحول الله تعالى لابحاث مستقبليه معاهم باذن الله. اليوم ما حيتكلموا عن البحث تبعنا، حيتكلموا بشكل عام عن الصحه العامه في المدن، البيئه المبنيه، التشريعات والمعايير اللي بتاثر على هذا الموضوع. فحترك لهم السبيس. Space is yours.
Thank you very much. Assalamu alaikum, everyone. Thank you for coming. I want to thank Fahad for organizing and inviting us and allowing us to talk with you. And I come to you with a lot of humility, because I'm going to be talking about how design of cities and environments affect health and physical activity. But I realize that I'm talking to you in the region where civilization started and people started building cities. One of our messages is the way that you've been building, that cities were built in the Middle East, in this region, for thousands of years, and worked for thousands of years, is the way we should still be building cities. But we have stopped doing that. And we're going to describe how damaging that has been to both health of the people and the whole planet. So let's start. So I'm going to be presenting some work as background about built environments and health, and focusing on physical activity. And I'm going to start by telling you why I've been focusing on physical activity, why it's so central to health. And then Dr. Adlaka is going to follow up with a specific project that we've been working on, that we're going to invite everybody here to participate in the next phase. So we're going to end this set of presentations with an invitation to you. So let's see if you are interested in that. So I'm going to be talking about a specific study as an example of much research that's been done about city design, urban planning, transportation, parks, and how they affect health. And this, I'm going to draw material that we published in 2020 in a prestigious journal, the Annual Review of Public Health. So, and so I'm the first author for a big team. So, here are the leading causes of death. And these are not the diseases that we usually think of as causing death. These are the causes of the diseases that cause death. All right. So, and most of them are behaviors. And some of them are not. So high blood pressure, tobacco use, high blood glucose, or diabetes are the leading causes. And then fifth is physical inactivity. Not doing enough physical activity, sitting too much, is one of the driving causes of death across the world. And you see that we're showing the information for high, middle, and low-income countries. And most of the deaths from physical inactivity are in middle-income and low-income countries, because that's where most people live. And the reasons that are leading to physical inactivity operate worldwide, all over the world, every continent. So anyway, that's part of the importance of physical activity. And this is just a very short list of the health conditions that benefit from physical activity. And I'm not going to read all of them, but you can see a lot of benefits for children, including physical health and mental health. A lot of benefit for adults, and this is not the whole list. This is just some of them. But you can see adults who are active live longer. They have less heart disease, less diabetes, less risk of 8 types of cancer. They have better mental health. And for older adults, they have all of these benefits, including cognitive function, but also if you're active, you're not as likely to fall. And you can do your daily functions without assistance, so you can live independently. So, physical activity is just central to health. So, and what influences physical activity? Well, it's things within us, some of the things within us, like age, sex, and our ethnicity, biology, genes, can affect physical activity, whether we're obese or not, and of course, whether you're already sick. But also there's social influences, the things that your family, friends, and peers do, whether they are active, whether they encourage you to be active. That can be important. The place of culture can play a role in physical activity. The media plays a role. Media mainly plays a role in getting us to sit and watch media, and attracts children to pay attention to the media and sit. But also, there are things outside of us and outside of our social system that affect physical activity, the environmental influences. So we're going to talk today about urban design, the way we design cities, our transportation systems, and the quality of green space like parks and blue space like water. All right? So that's what we're going to focus on. Because there's a lot, these are all choices that we make. How we design cities, parks, whether we take care of our green space. These are all choices that we make that affect our physical activity and thus our health. So I think about, I'm going to give you a little taste of the types of things that we've and others have been studying, and how they fit together. So I'm going to talk about the design of environments and cities at the macro level and then at the micro level. So at the macro, it's like you're above the city, and how is it laid out? And my conclusion I've been doing this kind of research for 20 years, and my conclusion is we can design cities to move people or to move cars. And I have yet to find a city that does both of those things well. So, we have made choices about how we design our cities. And so so I think about the way we can design cities to be activity friendly or activity supportive. And what makes the difference? Mixed land use. And that means that, it's the opposite of separate use zoning. So in separate use zoning, you put homes here, you put commercial here, you put industrial here, and you put education over here, and you separate them. So what does that mean? It means you can't walk where you want to go. So mixed use is you put everything together. You have houses near shopping, near schools, near businesses. All right. Connected streets. So, here is, in the U.S., the most walkable, the most activity-friendly neighborhood. And you probably recognize that as Manhattan. It's got Central Park. New York is extremely mixed use. Wherever you live, you've got a hardware store, you've got a bookstore, you've got too many restaurants and cafes. You've got everything you need in 5-10 minute walk. So people walk everywhere. The streets are connected. The famous grid pattern. Riyadh is in a grid, but the blocks are extremely huge. In New York, they're much smaller. So it's easy to get from place to place. The high residential density. You see all the big buildings. When you have a lot of density, you can support a lot of other uses. You can support many shops, many restaurants. You can have the schools close. So density is important. And then access to parks and recreation resources. So people have a place to do leisure activity. So of course, Central Park is great for that. And there's parks along the river here. There are bicycle paths along the river. And so maybe it's not a coincidence that people that live in Manhattan are the most active in America on average and the least obese. Here's the opposite. So this is single land use. Basically everything we see here is residential. And so all of this space, there's nowhere to go shopping. You can't walk to go shopping. The streets are not connected. Are these streets connected? If you wanted to go from here, visit your friend over there, these streets are not connected. You can't just walk there. You've got to get in your car, drive over here, go across, go over there. It's going to take you 10, 15 minutes to just drive there because the streets are not connected. It's all low density, all low residential density, and this looks like green space, but I don't think that's a park. Maybe you could walk your dog there, but there's no place to play football. You can't, there's no playgrounds. I don't see any playgrounds. And I took this picture, so that I can see if anybody can guess, where did I take this picture? Any guesses? Pardon?
The plane?
Oh, I took it from the plane, but what is that place? Yes, I took it flying into a city I had never been in before. I was not expecting it to look like this, so I took a picture to make a point. This is Cape Town, South Africa. So if you think car-dependent design is only in the high-income countries, that is incorrect. It's in Africa. It's in Asia. It's all over. It's all over. And you design a place like this, whether you design it this way in Cape Town or Saudi Arabia or the United States, you get the same effects. Traffic congestion, air pollution, carbon emissions, low physical activity, obesity, and chronic disease. And they have all of that in Cape Town. I experienced it. All right, so that's the macro level. That's what we're talking about. At the micro level, we go down to the street and say, what's the experience? You want to come in? Please. What's the experience of people being active on a street? And so, again, you can design for cars or people, and I have photos to illustrate that. So if you design for cars, it looks like this. A lot of asphalt or concrete. You want long blocks, so you want wide lanes so you can go fast. You want the cars to move. And if your goal is to move cars, then you don't plan for people. So you can see, here's a fellow, and I like to think he just came from a doctor's office over here, and his doctor told him to go out and get some exercise. So he's walking home, but there's no sidewalk. There's nothing there for him. There's a lot of noise. There's a lot of pollution. There's a lot of danger. Is he likely to take that walk again? No, I don't think he's going to walk on that street again. I would not want to walk on that street again. So we look at things like the quality of the sidewalk, which might be zero. There might be no sidewalk at all. The design of crosswalks. Is it safe to really cross? Do you have enough time with the light to get across? Curb cuts so that wheelchairs can go there, or strollers or prams for babies. Street furniture like benches, aesthetics. And so you see here the opposite. Not much room for cars, wide sidewalks, things to look at, interesting things to look at. You can get some ice cream or look inside the bookstore. And street trees to provide shade, to provide beauty, to provide comfort. All right? So it's designed for people. If you design it for people, it's nicer, and you would like to walk there. I would love to take a walk on that street. And we were we went to the Mazmak Fort today, and we saw a beautiful tree-lined street, and had shops there, and it was very pleasant, and people were hanging out and having a good time. But of course, most of the streets look like this. Most of the streets look like that. Okay, so that's a little bit of the background, and so this research on built environments and health is relatively new. In the early days, the studies were only done in a few countries, and we wanted to do a study that included many countries. And so we call this IPEN. It stands for the International Physical Activity and Environment Network. So I'm going to tell you a little bit about our study. And we wanted to encourage and assist environment research in many countries. We wanted to use the same measures and type of study so we could put all of our data together and compare across countries, which had never been possible before. We wanted to communicate the results to decision makers. So we wanted not to just publish this in the scientific literature. We're sure that this research is relevant for people who make decisions about the design of cities, or who do design cities, like architects, landscape architects, transportation planners. So we want it. So I'm so grateful that I can present this to you, because a lot of you are involved in this kind of work. So we had funding from the National Institutes of Health, the first study of its kind to be funded by the National Institutes. We recruited investigators from 12 countries. We had to look for volunteers. We would have liked to have had more, but this is how many we had. We've published a lot of results in scientific studies. And what I want to do here is summarize some of those results for you. I'm not going to go into great detail. I'm just going to give you a sampling of findings. Here's where our countries were: U.S., Mexico, Colombia, Brazil, quite a few European countries. Hong Kong, Australia, New Zealand. So there were big parts of the world that were not covered because we couldn't find volunteer investigators to do that. So hopefully maybe there's some people in Middle East and Saudi Arabia that could do this kind of study following on ours. We certainly welcome that. We'd love to see that. So we had 17 cities. This was a big study, over 14,000 adults in this study. And we recruited the participants to represent the range of types of neighborhoods. We wanted walkable, highly walkable, activity-friendly neighborhoods, and we wanted car-oriented, not activity-friendly neighborhoods, so we could see the difference. We were interested in what's the difference between those. And we measured environment in two ways. We used geographic information systems. I assume many of you are familiar with that. So it's more of an objective measure using data usually from the government. We also developed a survey, questionnaire, that asks questions about the types of things that I showed you at the macro and micro level. So it was people's perceptions, their reports of their own neighborhoods. Okay, so what I'm going to do here is I'm going to compare outcomes, and we're going to look at physical activity and basically obesity as our outcomes. And we're going to compare between cities that had the lowest scores for activity friendly and the highest scores for activity friendliness. In this one, we're looking at this stands for moderate to vigorous physical activity. And we measured physical activity in this way by using an electronic device. And we put it on their waist, and they wore it for 1 week. And so every minute, we could see how active they were. They took it off when they went to bed. So it's an objective measure of their movement for an entire week. Then we look at the environment, the objectively measured GIS and the reported environment. And we're looking at the difference per week in total physical activity. And so what this shows is this 35 minutes means the people that lived in the activity-friendly neighborhoods were doing 35 minutes more per week of physical activity than those in the not activity-friendly neighborhoods. So the recommended amount of physical activity from the World Health Organization is 150 minutes per week. This 35 minutes is about 25 or 30% of that. So 25% more physical activity is a lot. That's a lot. And the reported index, it was even a bigger difference. So it shows that the neighborhood that you live in is making a big difference in your physical activity. And this is objectively measured. So, and then we also asked people how long they spend walking for transportation, going to the store, walking their children to school, things like that, walking to work. And so this is active transport. So here, the GIS measure showed a bigger difference. This is 80 minutes a week. So the people in the activity-friendly neighborhoods walked almost an hour and a half more for transportation purposes every week. In the reported environment index, it was less. And then we also asked them about their leisure. So just going out to take a walk, walk your dog, go walking with your kids, enjoy life. And so the environment made a difference for that as well. Interesting here is that the reported environment index showed a bigger difference. And that's because I think that there were more variables or more characteristics that were included in those data, including aesthetics. So aesthetics, if you're going out to walk for pleasure, makes a big difference. You want to walk where there's greenery, where there's something beautiful to look at, where the buildings are attractive. Walking down a freeway, you don't do that for leisure. That's not enjoyable. You avoid that. So if all you have is freeways, you don't walk for leisure. You just don't do that. Or you drive to a different neighborhood to walk for leisure. Okay, and the last thing I'll show you is overweight or obesity. So the percent overweight or obese. Because if your neighborhood is making a difference to your physical activity every day, every week, for years and years, you expect that to affect weight at some point. And that's what we saw. The people that lived in the more walkable, activity-friendly neighborhoods had lower obesity levels by 7 percentage points. So if the people in the low walkable neighborhoods, let's say they had the average in the U.S. is like 70% overweight or obese. So, and then the people in the high walkable would be 7 percentage points lower than that. There'd be 63% overweight or obese, which is still high, but it's less. All right. So let me just, what did we learn here? Both the physical activity and weight status outcomes were substantial when comparing people living in the most versus the least activity supportive neighborhoods. And I told you that the 35 minutes per day of objectively measured activity, that's about 25% of the overall guidelines. And the results were similar for whether we measured the environment objectively or by self-report. And when we looked at multiple variables together, so that you had good sidewalks, and you had a lot of destinations nearby, and you had a park. When you had all of those things, it was better than just having one. So we need to think about an entire cluster of variables, and not just. So if we just put a park in a neighborhood, that's not enough. You know, you've got to have destinations for them to walk to. You've got to have safe street crossings. You've got to have everything. And we found that these results were similar across all the cities in all 12 countries. So it was similar. And it's not like this only applies in North America. No, it also applies in South America, in Europe, in Asia, in Oceania. So this is worldwide, and we want to do this in more countries. And I'm quite confident that this would also apply across the Middle East, and we're starting to see this in Africa as well. So this is just human nature being revealed. Okay, and here are some of our investigators from all these countries waving at you and greeting you. And you recognize that the characteristics of the activity supportive cities are how Saudi Arabia cities were developed starting thousands of years ago. And so all of that learning about making cities that worked for people so that people could walk to where they need to go and it was convenient, we and probably maybe starting in the United States, we just threw that away and said, we're going to design for cars. And it turns out that was a horrible, cataclysmic mistake because the rest of the world adopted that mistake. And so the results are many people dying much earlier than they need to, worse mental health, and not to mention climate change, okay, which is threatening everybody. So these are the stakes. This is what we're talking about. So now, I am finished with my talk, and thank you for being patient. And we're going to transfer the microphone to Dr. Adlaka, and who has I should tell you, I'm a psychologist by background. So I never studied physical activity. I never studied built environments. I had to learn all of that on the job. That was my on-the-job training. But she is a professional. She is a trained architect, a trained planner, and has a PhD in public health. So she knows what she's talking about. So you listen to her. Okay. Thank you so much. Thank you. Thank you. Thank you. So, no. The GIS tool did not monitor physical activity.
Okay.
We used an electronic device that we put on there.
But that has a geotag to it, so that you can watch. But my question is, how did you deal with personal data? I know you did actually work in North Europe, and there was a GDPR regulations that actually restrict and challenge research. And I'm intrigued to hear how did you maneuver around that? I've done some research using GPS chips to monitor people's walking activities and so on.
Yeah, we did a similar study internationally with adolescents. It's a separate study, and we did use GPS in some studies for that. And we worked with our human subjects in the ethics committees, and everybody gave fully informed consent. And we had full confidentiality and serious controls over the data in the computer. So we worked through all of that, and in 12 countries and even more with the adolescents. We just worked through it, and the adolescents wore the GPS and. And we said we're not going to tell anybody what it is. It's not being broadcast anywhere. We're just using it as data. So we worked through it.
Okay, then the other question is, how do you see the differences between the GIS results as opposed to the report itself, reported results? There are some changes.
Yeah, they made sense. I will say that they made sense. For GIS, we had to use a limited number of variables because there's no standardization of GIS data across cities, within a country, or across countries. So we had a small number of variables that were mostly relevant to transportation activity. So we saw that the GIS data were a stronger predictor of transportation data. But for transportation walking, but for leisure walking, the self-reported variables included the macro level. It included a lot of micro level variables like sidewalk quality and safety of street crossings and aesthetics, and those were more specific to leisure walking, and so we found the reported environment predicted better leisure walking. So the differences that we found make sense. Thank you very much for those questions. Please welcome.
Thank you. Thank you, Jim. All right. Thank you, everyone. It's a pleasure to be here. What I'm going to talk. Oh, good. Yeah. Okay. This one.
This is speaker.
Okay. Okay, so what I'm going to talk about today is looking at broadly how countries are applying policies in place for health and sustainability. So Jim set the stage for why this is important, and what we're going to do today is assess how cities and countries over the world are implementing these and what's going on. So we know now from the background that activity-friendly neighborhoods promote walking, cycling, public transportation. They help you be more physically active. There's also the climate component with reducing greenhouse gas emissions. And overall, this creates a healthy and sustainable city. Today, with countries realizing that they need to reduce their energy consumption. There's a lot of talk about climate action plans. Several cities are creating those climate action plans, but are we really monitoring what we're doing on the ground to work towards those goals? So this project really looked at measuring policies and understanding how cities are working on that. So in 2016, the Lancet, a very globally reputed journal, published the first series on urban design, transport, and health. And you will see from here, there were policy indicators and spatial indicators. So within policy, they looked at integrating transport and land use planning, air pollution, interventions, local level urban design, street scale, and also government investment. On the spatial side, it's similar to what Jim has just spoken about, measuring density, measuring street connectivity, distance to public transport and open space, and walkability. So what we did in this study was to extend that work. We wanted to facilitate the development of a global system of indicators to really understand, is it feasible to measure policies? Do cities really have those policies? And what is going on in inequities in access? And can we create a standardized method that we can then apply globally to cities? So city planning policies, what we're finding is they're upstream determinants of health and sustainability. But it's not just sufficient to have a policy, a broad policy. What we need is they have to be consistent with the evidence. They need to have clear and specific actions. And they need to be measurable. And they also need to have a budget attached to it, because unless you have that, nothing is going to change. So, quick overview of where we mapped our cities for this project. We have 25 cities in 19 countries spanning 6 continents, and we have over 80 collaborators. And we're hoping that by the end of this talk, we will start populating some in the Middle East too. From the first Lancet series, we then grew the work, and these were the 9 indicators we mapped. So I've already touched upon some of these. And within each of these indicators, we had a very detailed checklist of how we're measuring density, how are we measuring street design, how are we measuring distance to public transport. The questions we asked were broadly, do policies support the creation of healthy and sustainable cities? We had local researchers and policymakers who collected this policy data. So those 80 collaborators are part of this big team. And then we assessed each of these using a standardized scoring method. So comparison of cities. What we first looked at was an overall score for policy presence, and this was scored on 24. And then we had an overall score for policy quality. And that quality of the policy was also broken down into multiple indicators. So you can see from our sample, there's a wide range of policy quality and policy presence as well. Some of the gaps that we found, for example, if you look at the first 2 rows, 64% of our cities mentioned something related to health in their metropolitan urban policy. But only 16% were actually doing health impact assessments to test whether the policies were working. And similarly, across all the indicators, there was a wide variation of how those policy actions were being applied. Absence of measurable policy targets. So it's very difficult to measure implementation if you don't hold governments accountable. So if you have really broad aspirational goals, we see that nothing is really happening on the ground. But if you have specific measurable targets, then we see those cities making faster progress. So an example of a measurable target, Mexico City said every inhabitant, every person living in the city should have a minimum of 12 meters square public open space. In Auckland in New Zealand, they had 95% of the population should be within 500 meters of a public transport stop in 2021. And we found that these cities were performing much better in these indicators compared to the rest, because these policies were very specific, they had a percentage attached to it, and some of them also had a budget attached to it. So some examples that were inconsistent with evidence, for example, car parking restrictions in Phoenix. A lot of the policies in many US cities, you cannot build to a certain height or you cannot build mixed use unless you have a certain number of parking spaces. And that is going against the evidence that we have, because the evidence shows if you promote more walking and cycling paths, you will get more people living in that area. So a lot of our policies are also inconsistent with the evidence in general. So our summary, we found that we really need specific policies, we need measurable policies, we need to start benchmarking them, and those gaps in policies need to be addressed with local city councils, because the action really happens at the local city level, not at the state or at the national level. We also highlighted the need to promote capacity building in several low and middle income countries. We need policies to be informed by evidence, and we also need to have optimal thresholds of what works and what doesn't work in urban planning. So what's next? We are now expanding this work. Since we've done this work, air pollution has emerged as the fourth risk factor for global mortality. We also have an aging population where cognitive health issues are rising. So we really have an urgent need to integrate city planning. And then we had the pandemic, and the pandemic brought to light a lot of issues as well. City vulnerabilities, migration, people moving away from cities, needing more open space and green space. With the rise for work from home, remote work, how are we allocating our services and how are we promoting activity-supportive neighborhoods? So how do we build back better with 15-minute cities? We're talking with C40 cities and building a network of cities, so we're combining forces with them. And this is really our call to action. So the indicators that we've developed were just a starting point, and we're now expanding those. So we're improving some of the measures and really strengthening the indicators that we've identified. We've also highlighted the need to promote horizontal and vertical integration in governance. So making links across city governments and also across different disciplines is really important. And then at the civil society level, we're encouraging co-design. So with all of you here, reaching out to academics, reaching out to policymakers, reaching out to practitioners, and really promoting multi-sector, multi-income, and multi-country studies to see how we can expand globally. We also mapped some of the policies spatially, and we produced reports like this. This is an example from Sao Paulo, Brazil. So I'll get to our website in a minute, but if you log in there, you'll see for each of our 25 cities, we've created a scorecard and reports where you can download the data and look at how we've measured. So an example, so this is for Sao Paulo, this is Bangkok. We mapped walkability and public open space access. So this is a snapshot of showing you how neighborhood walkability varies relative to the 25 cities in our sample, and then the percentage of population living within 500 meters of public open space. And you can really see there are just pockets. A vast majority of the population does not have access to open space in Bangkok. So it would be really interesting to map that in cities in Saudi Arabia as well to see how cities are performing here. We also translated the reports into the local languages of each of those countries. So quick snapshot of that. This is for Baltimore, we have Mexico, and then we have Auckland. So that is our website. It's healthysustainableCities.org. And up on top, you will see the 25 cities. You can click on each and download the city scorecards and reports. And then right next to that, you'll see the 1,000 Cities Challenge as well. So this is an example of the scorecard for Mexico City. And you'll see we've summarized how each of those indicators, a green symbol means that the policy exists. And we've summarized with percentages what's the total population living within each of those indicators that we measured. So only 26% of the population had access to a fresh food market in Mexico City. And 98% were living above the minimum density threshold. Only 20% had access to formal public transport systems. So for each of our cities, there are these statistics. So next, this is our invitation. We have 25 cities now. We want to expand this work globally and really start measuring how cities are performing globally. So our goal is to get to 1,000 cities. And this is what we're working toward. So we invite all of you to join us in the 1,000 Cities Challenge. And with that, I will open it up for questions. And Jim is has been a key mentor to me throughout my career, but he's also a very close collaborator in this project. Thank you.
So I'll just add that with this 1,000 Cities work, we really want to have a movement of more citizens paying attention to their city governments and whether they're providing leadership in creating healthy and sustainable cities. And so we invite you to say, oh, I would like to take on the task of creating these indicators for Riyadh or wherever your city is. Or you might say, oh, I have a friend or a colleague who might want to do this. Or I know people in other countries that really should get involved in this. And so it's really all voluntary. It's really, in a sense, a citizen science. But the purpose is to collect these indicators, and it's all open source. So Deepti and her colleagues developed a guide for finding and coding policies, because they're going to be in policies of different sectors. And we're using open source GIS data in OpenStreetMap, which you might be familiar with. And we've got someone that's on the board of OpenStreetMap working with us to expand their efforts into countries, cities where they are not already working, particularly in Africa. So the data are free, and we think this would be something good to get students involved in, to work with advocacy organizations or professional organizations to do this work. And we're going to compile all of it so that each person can compare their data to any other city or the combination of all the cities. So we want to make this a very open, collaborative process. So let's see what questions and comments you have.
What are the main role of those volunteers? Because I know some people, as you suggested, I know some people who are interested in taking part in different cities. So none in Saudi yet who volunteered to.
When we did this study, okay, so the role, we will train them. We're developing a training system where we will have a webinar and we will show you how to capture the policies. We will develop a survey where you will input the policy data and then you can analyze it yourself, and we'll help you with that.
What kind of background do you think they should have, or any people interested in that? I know some historians, some. Is that okay, or is it something specific to landscape architects?
I think historians, anyone with a broad knowledge of even where to find the policies. For example, if we ask questions about, does the city have a public open space policy? So it involves a little bit of searching, looking at the government policies and trying to find them. And if they're not there, then you have the option of saying they don't exist.
Let me say, it doesn't take specialized training. And just for example, in 2 of the US cities, I had a master's student working with me, and they tracked down the policies and they coded those policies. So, and this was a public health master's student, so they did not have architecture or planning background, but they sought out people to assist them in city government. So they would ask somebody in the planning department, where can I find this? So they would just have to be confident enough to reach out to people.
Someone who takes initiative.
Yes. Somebody who's for the GIS, yes, somebody would need some GIS skills.
On your website, have you got those information? And
we have a link.
So then you check the
Yes, they can register their interest on the website. Yeah, we have a form.
We're in the process of developing the training.
Yeah. This work was published last year in August, September. So it's fairly new, and we're now developing more support for people who want to join us.
And I should say, this is not well funded. So we're kind of doing this on a voluntary basis because we think this kind of work is needed. And so there are no grants that we have to give, but you might be able to find local funding. To help.
We're happy to help write grant proposals with the local collaborators, because sometimes what happens is local cities may have some support to help at least with data collection, or if they're interested in producing a scorecard or an indicator report for their city to see how they're performing, there are possibilities. Yeah.
Thank you.
Yeah.
Thank you very much.
Thank
Good
you.
to see you watching fellow here.
Yeah.
For the indicators that you mentioned, and you mentioned C40.
Yes.
So that could be a segue to a plus 100 cities.
Yes.
So I was intrigued in the first half of the presentation, and very much when you referred to Phoenix and the policy implications, where there is a ratio to the built-up area in relation to the allocation of car parking.
Yes.
We have the same in Saudi cities.
Okay.
Every square meter has to be ratioed with the allocation of car parking. That is a responsibility of the developer.
Every square meter built space,
Whether it's a residential or office spaces or commercial.
Yeah.
So there is an embedded conflict to kind of densification, because as soon as you increase density within
you increase parking.
You would increase parking. So I would like to hear your views on how would you take policymakers into a decision or a framework to promote more built-up area where you can actually ensure that they are not banked with the ratio of car parking allocation, but also not to lead into a delegation of the problem to the streets, and then you create a parking crisis on the sidewalk. So I think that is a big challenge. Yeah. And Phoenix is an American city.
Most Indian cities have that. Yeah. So the one thing I heard from in a recent webinar is there is now research which supports that if you remove parking and invite more people to walk on the street, it increases the shopping revenue. And the reasoning behind that is when you're driving on the street, you're sitting on your wallet. When you're walking and cycling, your wallet is easily accessible. But there is real research in numbers to show how much shopping streets, they've been studied in Vancouver, in New York, to show how much revenue is generated when you have more active transportation along the street. So it's a question of now talking. I think the developer lobby is what we need to tackle. Policymakers are coming around to that, because when you show them this evidence, it is really out there. When you walk on a street and you're looking around, you tend to pause, you tend to linger. And this is grounded in a lot of theories in history, like Jane Jacobs said, eyes on the street. It improves safety, it improves shopping revenues, it improves economic development. So I think there is evidence there, but it's a question of competing economic interests. And once you convince people that this is actually going to be better for everyone, then you can make a case for it. It is slow. I think changing policy is slow. Implementing policy is also slow.
Let me. The other thing I'd like to say is that it really helps to think about these influences on and indicators in combination. Because if you've got a big residential building over here with nothing around it, just reducing parking is not going to create
Right.
places you can walk to. So you also need mixed use there, or public transit, so people can get from that place to where they can go shopping or go to work. So you really need to think from an advocacy point of view about the clusters of these things. And if you get hung up on just one thing, or you say, okay, we just need to change these parking minimums, that by itself is not going to solve the problem. You need to make sure that people can, that they have a place to walk to, and they have an alternative, a reasonable alternative to the car.
Yeah, and I think in our next iteration, when we're doing the 1,000 cities, we're looking at integrated planning more in depth. And we're looking at what cities are doing well, so the good practices they have, and also what's going against the evidence. So we're really looking at a holistic picture in the integrated planning indicator. Yeah.
Thank you so much for this informative lecture. And I'm wondering if you have, or if you consider the mental health in the equation, because the urban areas and cities after the pandemic and all these that changed our lives, the mental health was an essential part of it. And even during the last years, the evolution of neuroscience give the researchers the ability to understand the behavior of people and even the mood. So how can we link the impact of our cities, street lives on the streets, on these factors, and is the healthy services will help us to reduce or reduction in stress in the urban life, I mean. Because one of the earliest studies in 1903, I believe, was comparing between the life in urban life and
rural life. Yes.
This is bring us to the older question.
Yes.
The high density, the life in cities, overcrowded, contradict with the mental health, or can we see it from this angle?
That's a very perceptive question, there's several elements of that. One is that one of the best things for mental health, for both preventing psychological distress and for improving symptoms when people have anxiety and depression, is physical activity. And so think about it. When you're walking, taking a walk, you're seeing people on the street. You're feeling connected with your community. You are generating biochemicals that make you feel better. So that's a positive thing. Think about when you're driving. You're not generating those happy biochemicals because you're sitting. And instead of greeting people on the street, you're angry at them for slowing you down. You have road rage. Nobody ever talked to me about walking rage. I've never heard that before. And when you're in your car, everybody's your enemy. When you're on the sidewalk, everybody you see, you smile at them and say hello. I think that the mental health is going to be, we know, we've documented that the mental health is better when people are active and live in activity-friendly communities.
If I may just add to this conversation, I think this is really an important topic. But there are also urban attributes that kind of help decreasing stress. So there is a work for Jennifer Rowe in University of Virginia, and published a couple of times. And there's also Colin Erhardt and Waterloo University, where they measured the level of stress in urban environments. And I don't think we can just assume that urban environment will generate less stress. Actually, there are areas within the urban environment that actually increase level of stress and maybe lead to more. But I think, in addition to the policies that your discussion, the kind of urban indicators and the urban frameworks, I think there are physical attributes to the urban environment that actually could help within the whole environment of discussion.
Yeah, thank you. And I did mention, I forgot to address one thing you said, about crowding. And at really high levels, very high levels of density, that is stressful for people. All right, so there is that. But very few places have that. And most places are so far below that they'll never get to that level of density. So really, we're trying to get people from extremely low densities into some medium density. That's really the goal. And the other thing about it that I didn't mention, so, this is where green and blue space comes in. Having trees, having parks, having water. Those are signs of healthy ecosystems that we're, I think, programmed to enjoy for millennia. So and that's in our data. We want those aesthetics. We want the green space. We want the blue space, and all of that contributes. But you can't overdo the density. But again, it's not about any one thing. It's the package. It's the package of having a complete city, a 15-minute city. So you can this supports transport, active transport, walking, biking, supports active leisure, sports, just taking a walk, being in green space. Mm-hmm. So it's really this whole cluster of things.
I'm glad you mentioned Dr. Jennifer Rowe's book, Restorative Cities. So a few months ago, I was with her at UVA, and we launched her book at an event. And her book, I think, talks about blue and green space. And there's another aspect which we discussed when we met is gray space or brown space. A lot of cities have a lot of brown space, not necessarily any access to green or blue space. And how can we make those spaces also restorative? What are the qualities we can add to that? So those, I think, are discussions. Like if you look at the landscape here in Saudi Arabia, it's desert. And by the landscape itself doesn't have much access to green or blue. So in such climates, there is a lot of work that can be done at the street level to create those urban attributes that can promote mental health and well-being. But it's not going to happen if you're walking past fast-moving traffic. So those kinds of interventions at the street level are important.
I'm not sure if you heard about the Line City. Have you heard about the Line City in Lyon? Mm-hmm. I think that would be a good case study for that.
We thought about that, yes.
They're planning, I'm not sure if they still have the exhibition for the, no?
I would like to see that.
Because it's still conceptual
yes.
as a city, as the idea of a city. It's basically a line that crosses Lyon, which is in the north of Saudi. And the idea of having every single thing you need
within 5 minutes. Okay.
5 minutes.
Yeah.
Which is like amenities, education. Your work,
green space,
your green space, and blue as well, because it will overlook the sea. So, but it's still conceptual. I don't know how realistic will that be in application. It's a good case study to look at.
It is a great case study to look at. Yeah. And with the policy indicators that we have, it would be a wonderful project for somebody to take their plans and score it according to our criteria. And because that's going to predict whether it is going to be healthy and sustainable.
And in that exhibition, I wish it's still here, we would have taken you.
Just check their website.
It is?
It's on?
I can add it to the agenda if you want.
Yes,
Yes, please. We'd like to go. Yeah, we can do that.
You will see an exhibition of around 250, something like that, kind of plants they identified in that region only. And they were preserved.
Okay.
They started like planting again. Some of them are like fading. It's really interesting. But you will see the exhibition. It is conceptual as a city idea, but all of those new concepts and emerging concepts that researchers like yourselves have reached, they're trying to apply. It's interesting.
Yeah.
Well, you know, we would love for local advocates, and your Architecture and Heritage Organization sounds like one of those advocates, to take this information to them. And here are guidelines, evidence-based, about how you make healthy and sustainable cities. And it sounds like conceptually, that's what they want to do. So these are guidelines about how specifically to do that. And it's not a design manual, because you can, many ways to get to the same destination. So I think this could be a really great moment to integrate this work with that vision, so that it could help them achieve their stated goals. So I think as advocates, we need to be proactive. We need to seek out the decision makers and do what we can to, one, educate them, and then engage them in a dialogue of how can we help you achieve your goals with evidence-based strategies. And, that's a win for everybody.
Yeah.
Okay.
Thank you.
That's me to wrap up. Thank you very much, James and Letty, for this wonderful talk, which is, now I need to go back home and write too many papers because my mind is like, and maybe this is like a chance to say that I think our new proposal is about that, right? Thank you so much again.
Thank you.
These two are going to also present in Jeddah, I think, and next weekend they're going to be in Jeddah. So please spread the word. And they have many meetings in here: Ministry of Sport, Ministry of Umrah, Ministry of
Center for Local Governance,
and Princess Noura. They have a center.
King Saud University.
King Saud University. What is the there's
Center for Lifestyle Health at Princess Noura.
Yes, and I never heard of that. Letty find it out on the website, and I checked their work. They are doing really a great work on public health. So thank you so much again, and thank you for the questions. And we hope to see you in Jeddah next weekend. Thank you so much.
Thank you.